Rabies is a fatal disease caused by the zoonotic viruses, Lyssavirus genus. Once infected by the virus, it enters to the peripheral nervous system directly and migrates to the brain. It replicates within the muscle tissue where it is safe and evades from the host immune system. Rabies is an important public health problem that ranks 11th among infectious diseases that cause more than 60,000 human deaths worldwide, and rabies has the highest case fatality rate. Many countries are endemic for rabies except for Australia and Antarctica. Only a few countries in Asia, Japan, Singapore, Malaysia, Taiwan, Hong Kong, South Korea, have eradicated the rabies through mass dog vaccination and stray dog population control program. In Malaysia, rabies is a public health problem mainly along the Malaysian-Thailand border, where the disease has been periodically introduced through infected dog crossing over from Thailand. Rabies has to be known to occur in Malaysia since 1884 and the first human cases recorded in 1924. The main reservoir of rabies in Malaysia is the stray dog, and there is no significant signal reservoir of rabies infections appear in wildlife. National Rabies Control Program of compulsory vaccination of all dogs and a rigorous program of destruction of stray dogs. There is a success control program resulted in Malaysia being declared rabies-free in April 1954. However, there were some small outbreaks and sporadic cases of animal and human rabies once again commenced and continue to occur in the northern states of Perlis, Kedah, Kelantan, and Selangor.
Let's talk about the mode of transmission of rabies virus. The reservoirs of rabies virus are mostly animals. Cats and dogs are the most common biological vectors of rabies as they coexist with the human society. However, infected animals are not only limited to cats and dogs. For example, bats are host to the more virulent strain of rabies virus. So how does the virus infect the host? Rabies virus travels to the salivary glands through the cranial nerves. The virus is transmitted to the new host through the saliva. The virus gains access to the new host through wounds inflicted by the infected animals. The virus will be deposited in the wounds of the new host. This is why most commonly, the bites of cats and dogs are ways of the virus to be transmitted. There are also other ways a host can be infected with rabies virus. This includes inhalation of high concentrated of aerosolized rabies virus. For an example, a laboratory worker was infected and was killed during the manufacturing of rabies vaccine as he inhaled aerosolized generated in a biological laboratory.
The rabies disease is caused by the negative-stranded RNA virus rabies virus of the rhabdovirus family. It is a fatal disease that can infect all mammals. Once infection occurs, the virus would slowly progress and remain hidden at the infection site, showing no clinical signs. Since a threshold must be exceeded to cause disease, RV can have an incubation period lasting as short as 2 weeks or as long as 6 years, with the duration being highly dependent on the site of the infection as well as the amount of the virus that was transmitted. With bites closer to the head and around the neck having a higher risk, the virus becomes fatal once clinical signs appear. No immune response is detectable in most cases for up to 10 days post-clinical sign onset. The low immune response is possibly due to RV infecting the CNS and suppressing the immune system response through prevention of apoptosis alongside the elimination of the invading T cells. The pathogenesis of RV begins with the virus replicating in the myocytes after its entry to the skin or the mucous membrane. This is followed by the entry of the virus to the sensory and motor neurons at the bite location, where the subcutaneous tissue tends to have an abundance of autonomic and sensory innervations. This indicates that the entry and replication of the virus in the muscle fiber tissue is an essential step to access the peripheral nervous system. The migration of the RV into the CNS occurs through sensory and motor axons using fast axonal retrograde transport system. The virus is then internalized through receptor-mediated endocytosis after binding via G proteins, where RMP or ribonucleoprotein is then released into the cytoplasm due to the fusion of viral membrane with endosomal membrane, which is triggered by the low pH environment of the endosomal compartments. The interaction of the two factors, RVG and RVM, are responsible for the spread, transcription, and replication of the RV virus. Rabies virus glycoprotein, as mentioned before, RVG, allows the uptake of the virus due to its interaction with the putative cellular receptors such as nicotinic acetylcholine receptors, allowing for fast uptake, while rabies virus matrix protein, referred to as RVM, is responsible for the spread of the virus through transsynaptic transport. The RV would travel to the salivary gland in the final stages of the infection in order to be transmitted to another host.
Signs and symptoms. The earlier symptom is an abnormal sensation at the site of the bite wound such as tingling and severe pruritus. Next, the difficulty in swallowing may then occur and followed by painful spasmodic contraction of the throat muscles and the general convulsive seizures. So the first symptoms of illness are fever, anxiety, excitation, and malaise. This is a chart which shows the frequency of signs and symptoms in case of human rabies. As you can see, excitation is the highest frequency of signs and symptoms in case of human rabies, which is 100%, and the fever is the least, which is 35.7%.
After 2 to 10 days, frank neurological signs become manifest, ranging from hyperactivity to paralysis. This disease is divided into encephalitic and paralytic form. In encephalitic form, signs of irritations of the CNS become predominant, such as agitations, confusions, hydrophobia, aerophobia, hyperventilations, and hypersalivations. Paralysis involved the peripheral nerve is the presenting sign. This accompanied by fever but absence of sensory involvement. However, patients who present with the sign of encephalopathy can also be paralyzed. These symptoms reflect both cerebral and an autonomic dysfunction. Within 2 to 12 days, coma begins and cardiorespiratory failure is only a matter of time.
Among rabies prevention methods, vaccination is the most well-known and can be applied to both people and animals. Rabies vaccine can be given to people who have been exposed to suspicious animals, known as post-exposure prophylaxis. It may also be given ahead of time to people who have a high risk of getting infected with rabies virus, known as pre-exposure prophylaxis. Rabies vaccination contains the control rabies virus, and rabies immunoglobulin is used only for post-exposure prophylaxis. Moreover, people should keep themselves and their pets away from stray animals. Especially, pets should be supervised by owners, and leash should be worn when they're taken out for a walk. If there are too many stray animals, call Animal Control Center to remove them. When a person or pets are wounded, immediately wash the wounds with soap or cleansing agent, and an iodine-containing or similarly versatile topical preparation should be applied to the wound if possible. Then, should see a doctor or veterinarian as early as possible. Moreover, owners should spay or neuter pets if they want to avoid unwanted pets.